The Eastern Mediterranean region is grappling with conflicts and humanitarian crises in over half its member states and territories. Out of 22 countries and territories, 9 are classified by the World Bank as fragile or conflict-affected situations. 13 countries in the region are directly or indirectly affected by conflict. Currently, there are 15 graded emergencies in the region, including protracted conflicts. 110 million people are in need of humanitarian assistance. In response to the ongoing conflict in the occupied Palestinian territory, the World Health Organization, WHO Regional Office for the Eastern Mediterranean, has increasingly directed its focus towards its partnership with the United Nations Relief and Works Agency for Palestine Refugees, UNRWA. UNRWA's core mission is to offer humanitarian aid and protection to registered Palestine refugees across the areas in which it operates, along with the West Bank, including East Jerusalem, Gaza, Jordan, Lebanon, and Syria. The agency's mandate remains valid until a durable solution to the refugees' plight emerges. UNRWA has consistently provided high-quality healthcare services. Between 1950 and 2023, the Palestine refugee population increased from 750,000 to 5.97 million. Throughout this period, UNRWA initiatives resulted in significant improvements in health outcomes. As of 2023, 3.2 million, 52.9% Palestine refugees depend on UNRWA services. Conflict in Gaza and unstable conditions in the West Bank have placed further strains on UNRWA. In Gaza, over 90% of the population is displaced, forcing it to extend its services to more than 700,000 IDPs, seeking shelter and safety. By working closely with host countries and strategic partners, WHO in particular, UNRWA ensures that health services remain accessible and effective. It operates an extensive health program, providing essential preventive and curative primary healthcare services through 141 health centers free of charge, and supports secondary and tertiary healthcare via a reimbursement system. UNRWA's health program is supported by 3,126 staff members, including 539 medical officers, 40 specialist doctors, 121 dental surgeons, 1,051 nurses, 632 paramedical personnel, 736 auxiliary staff. Because of demographic shifts, 28.1% of registered Palestine refugees are now under 18. UNRWA's emphasis on maternal and child health has grown increasingly vital.
نتابع في الوكالة أنا وزوجتي وكل أهلي عشان نحن غزازوة تكاليف عالية والخدمات هون منيحة ومنتابع مطاعيم للبنات وكل أحمالها وتحويلات ومنتابع أسنان وضغط لزوجتي والدكاترة هون ما شاء الله عليهم كويسين.
The health needs of Palestine refugees have also shifted away from communicable to non-communicable diseases, with higher incidences of conditions such as cardiovascular diseases, chronic respiratory conditions, diabetes, hypertension, and cancer.
أنا مريضة الضغط والسكري، بتابع في الوكالة وبعمل الفحوصات الشهرية وباخذ العلاج وبحولوني على الطبيب، نفس الطبيب اللي شخص حالتي. بتمنى للوكالة إن تجيب لنا أدوية جديدة، بدنا عيادة نفسية، استشاري نفسي وطبيب نفسي في العيادة.
UNRWA has adopted technological innovations to improve healthcare services. The EMCH app for maternal and child health and the ENCD app for non-communicable disease patients were developed to provide access to electronic health records, appointment and medication reminders, and educational resources. The Gaza war has compounded the health challenges faced by Palestine refugees and introduced new challenges, including increased injuries, trauma, and mental health disorders. Limited access to healthcare services due to infrastructure damage, coupled with overcrowded living conditions, has exacerbated the risk of infectious diseases. UNRWA's Family Health Team approach offers comprehensive, person-centered care for families, improving long-term provider-patient relationships through the e-health system. By simplifying data access, extending consultations, and introducing health service dashboards for better data analysis, it has enhanced the quality and efficiency of care. UNRWA focuses on preventive measures, health education, screening, and effective treatments to address non-communicable diseases and mental health issues. Early screening enables timely intervention. Patients diagnosed with conditions such as diabetes and hypertension are referred to non-communicable disease clinics for management, including health education, lifestyle changes, medication, and when necessary, insulin therapy. Regular follow-up care includes blood pressure checks, plasma glucose tests, lipid and kidney function assessments, and foot care for diabetic patients. Biannual HbA1c tests ensure diabetes control.
تم تشخيصي بالعيادة هاي معي سكري النوع الأول من 5 سنين تقريبا. بتابع بنفس العيادة هاي من مختبر صيدلية بنفس الطبيب من سنة. الدكتور بنصحني أتحامى وأدير بالي وباخد جرعاتي كويس مظبوط، والدكتور بدينا على الصليل باخد دواي وبروح.
Hypertension patients receive frequent blood pressure checks. Annual risk assessments help tailor treatments and care plans. An appointment system reduces waiting times, and missed appointments trigger follow-up calls and reminders via the ENCD app. Recognizing the link between chronic diseases and mental health, UNRWA has integrated mental health and psychosocial support services into its primary healthcare system. Following WHO's Mental Health Gap Action Program strategy, trained staff provide mental health care for depression, anxiety, and stress, focusing on high-risk groups, including chronic disease patients, new mothers, and survivors of gender-based violence.
As head of UNRWA Health Services, I am honored to lead our mission to be a lifeline for over 6 million Palestine refugees across the Middle East, including Gaza. In our clinics, we care for over 300,000 patients with non-communicable diseases like diabetes and hypertension. To address this immense burden, we introduced the family health approach, delivering holistic and continuous care. This cannot be achieved with strong partnerships, particularly with the World Health Organization. Thank you so much. Even in emergencies, prioritizing NCD care remains essential, saving lives and reduce sufferings. Yet, we must remind ourselves that the peace is the best care for NCDs and for all.
The work of United Nations Relief and Works Agency, UNRWA, is crucial for the well-being of the Palestinian refugees. UNRWA is an indispensable agency uniquely mandated to deliver spanning education, healthcare, development aid, and emergency help to ensure that refugee communities have access to essential resources. By supporting primary health care, maternal and child health, and disease prevention, UNRWA plays a vital role in fostering health equity. Reducing UNRWA's funding will leave millions at risk. It's heartening to know that there are partnerships committed to strengthening resilience and promoting health equity in these communities. UNRWA's presence is vital to ensure a continuum of care for Palestinian refugees. WHO and UNRWA work together to enhance the health of the Palestinian refugees. Our collaboration involves sharing expertise. To highlight success of the WHO-UNRWA-UNICEF collaboration, 94% of the target population, which is over 550,000 children under the age of 10, received a second dose of polio vaccine across the Gaza Strip. This is an impressive accomplishment, especially considering the challenging conditions under which the campaign was carried out. By rallying more support and resources, we can help ensure enhanced health outcomes and a positive future for the refugee communities in Palestine. Thank you.
UNRWA is indispensable to our mission to improve health outcomes in the Eastern Mediterranean region. Recently, UNRWA was a vital player in the response to a significant public health threat the confirmation of circulating variant poliovirus type 2, also known as CVDPV2, in the Gaza environment in July 2024. The vital role UNRWA played in the emergency vaccination campaign conducted in the Gaza Strip between the 1st and the 12th of September 2024 clearly demonstrated how crucial it is for the health of a large sector of refugees. The campaign successfully vaccinated 560,000 children, significantly reducing the risk of a polio outbreak in Gaza. UNRWA's commitment to delivering extensive health care to Palestine refugees is remarkable. Their primary care, maternal and child health, and disease prevention initiatives are praiseworthy. Despite the challenges, UNRWA ensures vulnerable communities receive essential care. Our partnership, including the UNRWA Director of Health Secondment from the WHO, reflects our mutual dedication to health equity and resilience. Together, we aim for a healthier, more hopeful future.